The next set of questions is for Dr. Pavithra Mannam. The first question is, you had mentioned in your slides that the hippocampus is effective. And the questioner wants to know if you've come across any studies that have used neuropsych tools to assess the working memory.
Regarding the hippocampal involvement, I believe that there may only have been a few cases so far. And right now, the healthcare system is still trying to manage the acute forms of the disease and keep morale among patients, the public, and as well as the healthcare workers high. I don't believe that there are any large studies that have been done, but we can always prospectively design a study to look at memory in patients who have been affected by COVID. The other thing that we could do is also do functional MRI studies, but in the acute phase when they're sick, it's not very possible to do these scans. So we'll have to wait for them to recover and then have to call them back for the scan after writing up a good proposal, of course, for IRB. So we can expect to see some papers in the future.
Thank you. Another question for Dr. Pavithra. Is there a direct one-to-one correlation that you've seen with the neurological manifestations and that of the viral load?
I'll try to answer that question in two parts. So when it comes to the inflammatory syndromes, that is the neurological multi-system inflammatory syndromes, they usually seen very often in children. And their initial COVID illness is a very mild illness. So going by that, I would say that maybe the viral load was not that high. But the children's immune system is hyperreactive and it is reacting in a very aggressive manner to the existing viral antigens. It is more of a viral, it's a body's reaction rather than the virus itself that causes these inflammatory syndromes. As far as the prothrombotic nature of the illness and causing infarcts in the acute phase, I am not entirely sure if there is a correlation between viral load and the incidence of neurological manifestations. But it is definitely something that is worth looking into. I'm not aware if somebody has already looked into it. If there is somebody in the audience who has experience, can share maybe now.
The third question is again to Dr. Pavithra, a more general question here. As a neuroradiologist, what has been your experience in the COVID times?
As a neuroradiologist, my experience has been that there was a drastic difference in the number of neurological manifestations that we saw in the first wave versus the second wave. And I think we were mentally more prepared for the second wave than we were for the first wave, mentally prepared. So the reality was that we were overwhelmed by the second wave. So I think a lot of patients were managed without imaging them, even when they had symptoms, because of the problems with keeping the room empty for some time, fumigation, whether it works or not. All these kind of concerns may have limited the imaging in patients who may have required imaging. So I have seen, definitely have seen infarcts, definitely